listening to the program and us hearing from our guests to learn more about a lot of things. That's what we do on Spotlights, okay? And this morning we're understanding the risk factors for hypertension in Lagosians. Lagos is a bustling city. We have our guest in the studio with us. I will introduce him shortly. He's joining via phone, but his spirit is in the studio. Dr. Emeka is on standby, and I'll introduce him shortly. I am Kimberly, your host on Spotlight, where we get to dissect trending topics the audience can relate with. Of course, talk about politics, governance, health, education. Yeah, so you name it. All right, so the Lagos State Commissioner for Health, Professor Akin Abayomi, has revealed that over 8.7 million residents have high blood pressure with hypertension, this condition, unaware that they are living with hypertension. Abayomi, who explained this during a media chat with newsmen, said that a significant portion of the city's 30 million residents are living with this, and also, in line with diabetes, which we talked about on World Diabetes Day, obesity, yet remain unaware. And that makes it more serious. That makes it a cause of concern when you're not aware that you're hypertensive or not. So, in a public health efforts, the state government has launched a statewide free screening for hypertension and diabetes for Lagosians. This, it said, is an initiative under the Nigeria's Governors Forum nationwide campaign aimed at addressing the silent killer. That's what it's called, hypertension and diabetes. So they said silent killers, they are cousins. So to support the accessible healthcare, Bayomi assured that the government, through its social health insurance scheme, Ilera Eco Health Insurance Scheme, allows subscribers to access year-round checkups for hypertension and diabetes on the standard, I think there's a package tied to that. Now, Dr. Uke Kachinedu, a resident doctor in family medicine, is on the line with us this morning on Spotlight. Good morning, doctor.
Good morning, Kimberly.
Yeah, good to have you. How do you feel about TGIF? I guess you're happy it's Friday.
Yes, I'm happy it's Friday.
Okay, so do you doctors get time off? Don't you work over the weekend as well?
We work over the weekend.
And then you can't be happy it's TGIF. Else you
But
get to.
sometimes we do have the time off.
Oh, okay, I see. Yes, so that you don't burn out and you can take care of us. Okay,
Yes,
so we're looking at hypertension, which is some would say is a silent killer.
yeah.
Over time on the program, we've linked it. Some doctors that have come on have connected it to some other diseases like diabetes, stroke, and the likes. But now we're focusing on hypertension this morning. So
Now,
let's hear from you, Dr. Chinedu. What is hypertension?
hypertension is an elevated blood pressure of 140 for the systolic and 90 for the diastolic, taking over an average of two or more seated BP readings, or when someone visits a hospital or an outpatient clinic about two or three times with elevated blood pressure.
Okay, so now, we're not all doctors. What is symbolic and apholic? What did you call those two? Can you just break it down?
Systolic is how the heart beats.
Mm.
Yes, why diastolic is more of relaxation. When the heart contracts, it's called systolic. When it relaxes, it's called diastolic.
Okay. All right.
Yes.
So now, is this a disease or it's a condition? Well, how does it? What exactly is it? Is it contagious? Is it a waterborne disease?
No. First, before looking at the disease, we have to look at the classification of hypertension.
Okay.
What is normal and what is abnormal? In the classification of hypertension, first, a normal blood pressure is a blood pressure less than 120, as I said, for the systolic, and less than 80 for the diastolic. Then you have pre-hypertension, where the systolic is between 120 to 130, 139. Then diastolic is between 80 to 89. Then you have stage 1 hypertension and stage 2 hypertension. Stage 1 hypertension is a blood pressure of systolic of 140 to 159, then diastolic of 90 to 99. And stage 2 is blood pressure greater than or equal to 60 millimeter mercury for the systolic and above 100 millimeter mercury for the diastolic.
Mm.
So people are at different stages of this, from pre-hypertension to stage 1 hypertension to stage 2 hypertension. And
Okay.
we can even go further to have hypertensive crisis.
Mm. Okay.
Yes.
So can you just expatiate on pre-hypertension? You said pre-hypertension, right?
Yes. Pre-hypertension, the individual is not hypertensive yet, but there are risk factors. So we tend to dwell more on lifestyle to stop the person from getting to being hypertensive. So it's
Okay.
just like a warning, like how you have pre-diabetic patients where the blood sugar is not, the person is not diabetic, but the person is at risk of
Hmm.
having
Of
diabetes.
coming down with it. Okay,
Yes.
so it's something that's like I said, how do you get it? Okay, maybe that's will be classified under risk factors. But I'm trying to understand, is it an STD? Is it a waterborne disease? Is it something that just comes up as a result of the heart not functioning well? Or what exactly? How does it come?
Foods, which puts us at risk. Obesity, which also puts us at risk. Sedentary lifestyle, that is lifestyle of inactivity, can still put us at risk.
Mm,
Then non-modifiable are the ones that we can't change them, age-related. That's why you see that most elderly people are hypertensive, though you
mm,
see hypertension in young adults. Age-related from 65 years, you see them being more hypertensive. Then
mm-hmm,
family history of hypertension. Some people have hypertension running in their families, so they're likely to be hypertensive. Then,
mm,
if there are other coexisting diseases like diabetes, chronic kidney diseases,
yeah.
yes, people can still have hypertension. So these are non-modifiable risk factors that can make people have hypertension.
Okay. So over time, I've heard from some. I just want you to say if this is correct. They talk the heart beating too fast and something beating against the heart walls or something like that, and that's what you would say hypertension is. That the heart is beating, beating, and then becomes hard or something. Can you just is that correct?
No, those are more with the complications that come with being hypertensive over a long period of time.
Okay.
Yes, you can have cardiomyopathy from being hypertensive, uncontrolled hypertension. Yes, can bring about all those all those things you're talking about. So those ones are more of the complications that comes with hypertension
Associated with it.
if they are not controlled. Yes.
All right, so now let's focus on the risk factor. And I want to hear from you which is more prevalent in Nigeria. Which do you get to see? And I wanted to ask as well, is are mental issues also a risk factor for hypertension? What I mean by mental illnesses,
Mental illnesses,
are they also
no,
risk factors for hypertension?
they are not risk factors. Though some people may have triggers. Someone that is hypertensive may have triggers that may increase the blood pressure from probably you have a blood pressure of 140, you are in stage 1. So then some triggers, psychological stress over a long period of time can trigger it and it will go up.
Okay. So all
Yes.
right then. So how about genetic? You talked about it being genetic. So I said which is the most common reason you have um hypertensive patients?
Okay. Family history, age. Hmm? Family history and age is one of the most common reasons. Then unhealthy lifestyles, excessive alcohol consumption, use of tobacco comes up again.
Okay.
Yeah,
That's
these are the risk
smoking.
factors.
Okay. Yeah, but with your
Yes.
patients now, like what is the most common? And is it more common with women than men? Do you get to see more women patients coming that they have BP than men?
Though I've not really done a research to know whether it's more
Which
in
is
men
more?
or
No,
women.
but
Those maybe
if
more
you're
in
gonna do it
men.
empirically, like just looking
Yes,
at what you have
I see
around you.
more males coming with hypertension. Yes. But the
Okay.
risk fact, most of the times, you discover that people that don't take their drugs or don't take their drugs regularly are the people that normally present regularly to the hospital for their blood pressure to be controlled.
Okay. All right. So because I asked you because over time, like when I go to the hospital, for maybe checkup, you get to see
Mhm.
more women, more married women in hospitals complaining about BP. You know, and even when I engage one or two doctors in chats, they would say that marriage too, when the women are under a lot of stress. That's why I had to ask you of the contributing if some kind of psychological pressure or stress contributes to it, or even pregnancy for women, or yeah.
Yeah, they have actually have hypertension in pregnancy. Hmm?
Okay.
Yes. So those ones can also count. And also, I think women are more have better health seeking behavior than male. So males males that are unaware can still be having hypertension and not come to the hospital.
And not come to the hospital. All right.
Yes.
So how about diet? Are there certain diets that makes one increases the risk of one coming down with hypertension?
Okay. Well, first we talked about excessive salt intake, and we talked about high high saturated fat diets. Hmm?
Mm-hmm.
Yes, can put people at risk. We normally use in managing patients for hypertension. We normally use what we call DASH diets, dietary approach to stop hypertension. Hmm? The
Okay.
dietary approach includes low fat diets, for the patient to be on low fat diet, reduce salt intake, then more fruits and
No, I'm not.
vegetables.
I'm not talking about the cure now. I mean, like, are there certain foods that when you eat it over time, you're likely to come down with hypertension?
Yes, as I said, on high saturated diets. Hmm?
Okay.
Yes, and diets that are high salt diets. These are diets that put people at risk. Hmm?
Okay.
Then we can still bring in alcohol because it's part of some people's diets, excessive alcohol consumption. Yes.
Yeah.
So these are the risk factors. Hmm.
Okay. Now, how prevalent is hypertension in Nigeria? I know in Lagos, the commissioner gave the statistics saying that about 8.7 million residents have high blood pressure. That's even the data that is obtainable. Some He added that some are not aware of the condition. So that's just
Hmm.
an estimated 8.6 million. But I understand that you practice in the southeast. So, but generally, how prevalent is hypertension in Nigeria, and how serious is it? How much of a public health concern is it?
How serious is the public health system in addressing hypertension?
No, how prevalent is hypertension in Nigeria? How serious is hypertension? Um, how seriously should it be taken?
Yes. Is a very serious thing
Can
in
you speak
Nigeria
up a
because
bit? I find it hard to hear you.
I said, can you hear me?
Yeah, I can hear you.
Okay, okay, okay. I said hypertension is something serious in Nigeria because, as you rightly said, the commissioner said that it's one of the silent killers. Hmm?
Okay.
I said, as the commissioner for health said that it's one of the silent killers.
Mm-hmm.
Yes, most of the heart failures we have and heart disease, myocardial infarction, that's heart attack we have, maybe as a result of uncontrolled hypertension for over a long period of time.
Mm.
According to WHO, 1.2 billion people have hypertension all over the world, and about 46% are still unaware.
Mm.
Yes, so we advise people to do regular checkups, can go a long way.
Yeah.
Regular checkups in primary health cares can go a long way in identifying people who are hypertensive.
Okay.
Yeah.
All right. So, what are the typical symptoms of hypertension? How do you recognize them? If you're going to break down the stages, like you said, just expatiate.
Okay. So normally, most people don't have symptoms. Most people don't present with symptoms. But in terms of people have coming with hypertensive crisis, they can present with symptoms.
Okay.
Hypertensive crisis is, I think, is further divided into hypertensive urgency and hypertensive emergency. For the urgency, the blood pressure is equal to above 180 milligrams, 180 millimeter mercury for systolic, and
Okay.
110 millimeter mercury for the diastolic. Then for the emergency, you have the same systolic of 180 and diastolic of 110 with target organ damage. So the
Okay.
target organs include the brain. Hmm?
Okay.
So these people may come with confusion. We call it hypertensive encephalopathy, headaches, yes, blurry vision,
All right.
hypertensive retinopathies, and some of them may even come with um, cerebrovascular accidents, which is stroke. Hmm? Signs and symptoms of cerebrovascular accidents, which is stroke, which will include seizure disorders. Some of them will come with paralysis of um, the contralateral limbs.
Mm.
Then, while some may even present with nosebleeds, then if it affects the heart, some can come with chest pain, heart failure. That's difficulty in breathing.
Okay. All
Yes.
right.
Why if it affects the kidney, some of them will come down with chronic kidney disease.
Okay. So now, for like the early symptoms you said would involve a headache. Are these normal headaches or migraines? Do the headache persist for days, or is just something that will come and disappear, or you keep having it go on for days?
Yes. Once it comes down, the blood pressure is controlled. The headaches may just subside.
No, I'm
These are
saying
just
that the symptoms. How you know that? What are the symptoms one can use to identify it? You mentioned headaches, right?
yes. I mentioned headaches if end organ damages are setting in. Hmm? Yeah, some people may have mild headaches, and so they will decide to check their BP and discover that A is on the high side.
Hmm.
Yes, even some people that are sick over a long period of time may still have symptoms with high BP, then other symptoms. Um,
So how about dizziness? Does that happen? How about dizziness? Is that a
okay,
sign, a
cerebral
symptom
edema.
of? Yes. Is that a
It's
symptom?
still part of the end organ damage when you have people have kind of subarachnoid hemorrhage where some vessels in the brain will probably burst and there will be increase in pressure in the head. So you call it an edema, cerebral edema. So that is still part of the hypertensive emergency we're talking about. So
Hmm.
those ones are emergency. It's not just the normal hypertension where someone doesn't have symptoms, just elevated blood pressure that needs to be controlled.
Okay, so what was the point where someone has hypertension, you don't know, but then you slum? We hear cases of people slumming and they don't have this migraine, and is it that it didn't present any serious symptoms before then?
Hmm? Come again, please. Let me hear
Yeah,
you.
I said, what of cases where people get to the point where they slum? Uh, some medical experts have attributed it to hypertension, blood pressure.
Oh,
Can you
your
hear
your
me?
line. Your,
Okay, I said, how about cases where we hear people slum over time after they've had hypertension for an extended period of time?
okay. I think that's hemorrhagic in terms of hemorrhagic stroke, where you have elevated hypertension of over 200, you see them fall. There is a stroke already. So the person will need to go and do a CT scan to know
Can the person
if it,
stand up after he falls from a stroke? Because
Some
that's why
of
it
them,
is most times they slum and go on from there. We don't see them come back. It takes a miracle for someone to slum and then be able to stand up and go to the hospital.
it depends. It depends on where the stroke happens, the part of the brain it happens. Yeah, some of them may lose consciousness initially, then regain their consciousness. But the you may have affectation of the right or the left limbs
Mm,
where they are not able to use both. So
okay.
a stroke, we say the person has had stroke, then we send you to do a CT scan of the brain to know if it's actually a hemorrhagic stroke caused by hypertension, hmm, elevated BP, or is it an ischemic stroke where the vessels in the brain is blocked and reduce blood supply to the brain?
Okay. So
Yes.
like some ladies, I told you some have said that it's common among women and not just women married, pregnant, women. But now you said the headache only comes when it is very severe, but I've seen one or two cases where the migraine continues for days and the dizziness comes up, and then they go to the hospital and it's hypertension without any serious complications. So,
Okay. Yes. Yes. Someone may have hypertensive emergency. It's not as if you have all the symptoms. It may just be evolving. Yes. And by the time it's managed, everything can just come back to normal. Because in hypertensive emergency, we try to reduce any form of target organ damage. Yes. While
okay.
some people may just have headaches, it's not their BP is high, they have headaches, yes. By the time you reduce it, they get better.
Mm.
Yeah.
All right then. So, how about how is it diagnosed? Is it some
It's just by measuring your blood pressure. That's for primary hypertension or essential hypertension. Hmm? Blood pressure taking two or more times in a sitting position apart, or when you visit a hospital like two or three times and they take your blood pressure and they said, your blood pressure is high, so we can see you are hypertensive. That's
mm,
for primary hypertension. But for secondary hypertension, you will have to go further because there are other causes to do other things, doing a kidney function test to know is there any kidney affection that is making this person hypertensive. Then you can now do all those endocrine issues. If the person is diabetic or the person is having some thyroid issues, yes, we can now go further and say this person is hypertensive, or we'll check the lipid profiles, do electrocardiograms. These ones are done to just rule out secondary causes of hypertension. Normally, primary causes of hypertension, essential hypertension, causes about 95% of hypertension.
mm. Okay, so
Yes.
now I'll have to take you some steps back. I want to understand the correlation between stress and hypertension. Lagos is it's a very hyper city. And we're understanding the risk factors for hypertension in Lagosians. Stress now, not even psychological stress. Is there a correlation?
The stress are just triggers. They are not, I won't say they are risk factors. The person may have factors. Risk factor is already there. It's just that the stress is a trigger. Someone may have stage one hypertension, hmm,
Mm.
and is overstressed physically. Then you see it showing up. So you can say stress is actually contributing.
So, are there certain hormones that stress, brings up, comes up? How do I put it now? Are there certain hormones that are stress induced that, on the long run, could cause hypertension?
Normally, the body is built in such a way that we have what they call cortisol, stress hormones, that tends to regulate stress whenever we have those issues. If there are hormones or any other thing that will cause hypertension, they will fall under secondary causes of hypertension. Yes. secondary causes of hypertension. That's where they will fall, or they will fall under. Mm,
Mm-hmm. Okay.
mm, yes.
All right then.
Hypo aldosterone, hyperaldosteronism are called secondary causes of hypertension.
Okay. So
Mm,
now, what are the common treatments for hypertension?
okay, so it can
Without
be
calling the
lifetime.
name of the medication, just
Mm,
I said without calling the name of the drugs, just what are the common treatment for hypertension?
okay. Yeah, we have lifestyle modification. There are two ways we manage hypertension: lifestyle modifications and pharmacologically use of medications. Yes, and we you do that together whenever you're managing a hypertensive patient. Mm.
Okay.
Then in managing hypertensive patient fully, we normally do what we call a history taking, mm, where you know if they have symptoms, the family, if they are the factors, risk factors for hypertension, because you have to identify the risk factors, mhm, of where it is coming from for you to control that hypertension. Supposing if the person drinks alcohol excessively, from the risk factors, you will say, okay, stop drinking alcohol, stop the use of tobacco. These are where you come from. Then further and social history, family and social history. Is there any family history of hypertension in the family or family history of heart diseases in the family?
Mm.
Then you go further to now do your examinations, general examinations, then cardiovascular examinations, that's examinations for the heart.
Okay.
And then go before you do any investigations, if there is anything found. Yes.
Okay.
Then in now treatments, you will now do a lifestyle modification and medications. The lifestyle modifications now, I talked about the DASH treatment, DASH diet, which is dietary approach to stop hypertension, where I talked about low fat low fat diets, reduce salt intake, fruits and vegetables.
Mm.
Then exercise to reduce the body mass index, normal body mass index between 20 to 25 or 20 to 24.9.
Mm.
And yes, reduce sedentary lifestyle by exercise too.
Okay. Yeah, we're still going to come back to that. But now, something I forgot to mention earlier. The commissioner and some health experts have pointed out that it is now common among younger, like the youths, the younger generation. Before, hypertension was called old people disease, in quote, old people, like, old is relative. Well, but now it's like, okay, these are not for young people. So now, why do you think this is the case? Why is it now more common among youths?
Okay. Normally, one of the commonest causes of hypertension in youths is more of a secondary hypertension, though they can have primary hypertension. Secondary hypertension. Someone that has a chronic kidney disease can have hypertension. And secondly, most of the youths that already have a family history of hypertension, then they indulge in other things like tobacco smoking, then and excessive use of alcohol. This puts them at risk too.
Okay.
So whenever I see a younger person, when you probe for the primary causes, you also go for the secondary causes because they are always likely to have a secondary cause of hypertension compared to an elderly person.
Mm. So you're saying that the the surge in drug abuse and what of ambition? Like, okay, you said psychology is like not really a direct cause, but I've heard word
Mm.
on the street that okay, fine, because of the over ambition, you want to achieve this, you want to achieve that, you put your body through a lot of stress. So is that correct? And some would even say because you're always laying down with your smartphones or smart devices, you're not exercising enough,
It's
can
not
contribute.
smartphone. And also lifestyle modifications. Some children are also obese, so they
Yeah.
can still see What we eat is also contributing. Our lifestyle, sedentary lifestyle. If you're talking about, let's you're talking about inactivity.
Yeah.
Yeah, sedentary lifestyle can also be a cause as it's coming up in young people. People spend more time on their phone than they go for they go to do exercise and all those things.
Okay. So now we've talked about the diagnosis. We talked about. Did you talk about that thing where they have to wrap around your arm to diagnose the hypertension? Uh, BP checker.
This sphygmanometer.
Okay. Yes.
Mm.
So that you talked about. It depends on how severe it is, right? That's what you talked. That's what you said. So how? What other treatment options? Have you talked about lifestyle changes that can help to?
Y- Yes, I've talked about lifestyle changes in treatment options. When I talked about the DASH diets, talked about exercise, mild, moderate exercises. Some people can start with elderly people at least can start with brisk walking every
Okay,
other
so
day.
how important is medication adherence for managing hypertension? Because when you give some people drugs, I understand that after it goes for 2 days, they might just go off the medication. So how important is it?
Okay. Normally, when people come in, we normally give them, we can give them 2 weeks. Hmm? Tell them take your blood pressure, check your blood pressure every day and document it. A follow up, so we can then put you on the medications. Then we monitor you and see how you are going on that medications. Then we now advise people to tell them that hypertension is not a curable disease. So you have to be on those drugs for a lifetime. The work of the drugs is to reduce your blood pressure and stabilize it. Because some people think once their blood pressure has come to normal, there is no need to be on the medications. No.
Mm. So
Yes.
what is
Once they
yeah,
stop it, you discover that it goes up. So adherence to the medications is very important.
okay. So does it go up and the situation becomes worse, or does it just go up and then it can come down again when you go back to the drugs?
Yes. Normally, we place them on, we still do that 1 week follow up, replace them on the drugs. Then, if they are not doing well, because we normally have a monotherapy where we give you just one drug before we move to two. So, if the first just monotherapy is not controlling it, we can now introduce a second medication to add.
Okay.
Yes.
So, what is the reason sometimes when a patient is on BP medication, the BP is still not controlled?
One is if the patient is not adhering to the medications, it can cause that. Secondly, sometimes you may require two or more drugs for this patient. The first one may not be enough, or the dose is not enough. So we decide to increase it. Or the person is resistant to the medications, then we decide to change entirely.
Those are all the reasons.
Yes.
Okay. All right. So now I was going to ask you, is it something that goes away on its own? Do you pray hypertension away? Or it's something that has to be treated in the hospital
Is it hypertension? No, it doesn't go away. You continue to be on medications for the rest of your life.
for the rest of one's life? So there's no, it's
Yes.
not like you be on it for a while and then it will go. It's
No,
just
no, no.
permanent.
Yeah.
Okay. All right. So, what are the potential complications of uncontrolled hypertension? What I know you talked about some, or if you can expatiate, what happens if you don't control your BP?
Okay. All right. Starting from the brain, you're at risk of having a stroke or hypertensive encephalopathy. The eyes can be affected. We will have hypertensive retinopathy, where the person complains of blurry vision. Then they can still have, for the heart, the risk of having heart failures, uncontrolled hypertension, hypertensive encephalopathy, hypertensive cardiomyopathies,
Hmm.
as I said before. Yes. Then the vessels can be affected, the vessels of the hands, the vessels of the legs, we call it peripheral peripheral artery disease.
Mm.
They are at risk of having peripheral artery disease. Then the kidneys on their own, the kidneys, uncontrolled hypertension can affect the kidneys, as well as the kidneys can also, chronic kidney disease can also affect, cause hypertension that way.
Mm.
So these are more of the complications that comes with hypertension, uncontrolled
Hypertension.
hypertension. Mm.
And then I guess also when we hear about slumming, right? When people just fall on the ground and slum.
Those ones
I
are
had a
more of,
distant, yeah, because I had a distant aunt. She's dead now. So she got off the medication and she just believed that it would go away. So while she was away for a particular program, she slummed and that was the end of it. So that's
yeah.
why I was trying to understand because she got off the initially she was on the medication and then she said you know well she just believes that she's going to recover from it. So that's why I really want you to emphasize on how important it is to adhere to the medication and because we see this often where you take it and after a while you stop and but I want to ask you, does the body grow resistant? Like we hear that happen in and with antibiotics, where you take it and when you stop it, doctors would say that your body would now grow resistant to the antibiotics. That's why you should not take it. I don't know if you can confirm that's true. But now, does that happen with hypertensive drugs as well?
It can still happen. It can say abuse of medications could cause resistance to the medication sometimes. It can still happen. But
Okay.
it's not like that of antibiotics that you can when you abuse it much, you will have resistance. It
Mm,
doesn't happen like that. It's not doesn't happen much like that one.
mm,
Okay. Yes. Then for your auntie, I think she had possibly a hemorrhagic stroke. Most of the times, hemorrhagic stroke, which is mainly caused by elevated high blood pressure, over 200. Mainly, you see them, the individual will be in doing a particular activity,
mm.
either talking or dancing. Then what you see is the person falls,
And I.
loses consciousness, yes, and
Okay,
have
so yeah.
seizures.
All
Mm.
right. So now, the how dangerous is self medication when it comes to hypertension? Because now the reality is a lot of people don't want to go to the hospital anymore. They just want to Google the symptoms, Google the medication. So what's the danger associated with that when you Google and just take any medication for hypertension?
Okay. And normally, those some of the drugs do have side effects. Yes, some of them do have side effects. Some of them even cause leg swelling. Mm. And some of them, if you have low electrolytes, if your electrolytes are very low, we may not want to give you them like the ones that make you ease yourself. You need more often. And if your electrolytes are low, we want to give you more to lose more electrolytes.
Mm,
And so self-medication it doesn't do them well. Yes.
mm,
In the primary health center, they can give you they just one medications and they'll now tell you come for follow-up. Yes. When you come for follow-up, they will ask you, are there side effects? Are you having any side effects? You can now say, tell them when I take the medications, this happens, this, that. They may decide to change the medications based on the side effects you are
mm,
having.
mm. So you sound a bit
Yeah.
indifferent when it comes to self medicating. Like, do you think it's something that could lead to death? Actually,
Mm,
you're not sure
normally,
if it will lead to death.
yes. Normally, most people just go for the there's this calcium channel blocker that I don't want to mention the drugs.
Mm.
Most popular used mainly in blacks. So it's easily affordable. mm, It's easily affordable, and most of these people get them when they go for these health programs, little programs where they are seen and their blood pressure is taken and they are giving it to them. So when they get it, they tend to go back to get it by themselves.
to get it by themselves. No, that's not even the
Yeah,
one I'm talking of. I'm talking of before prescription. Like some will
before,
just go
after you
and
must
get it
have.
themselves. Yeah, like you just feel like, oh, I have BP, and you just walk into the chemist or a pharmacy, and then you just get a BP medication. But because we hear that, that would slow the heart rate
Uh,
totally, and the person would die. I don't know if that's
uh,
true.
the the thing is this. For example, now someone has to make that diagnosis that you are hypertensive. Hmm?
Mm-hmm.
Yes, either in the hospital or even in primary health care. Yes. So if you check your BP and you say, it's high, at that point, you've not made it there, you just checked it once and you say it's high. So even taking those drugs can crash your blood pressure if actually you are not hypertensive. So that is why self-medication is bad on this.
So
You
what
see the
is it?
person coming
Yeah,
coming into the hospital with very, very low BP because the BP was actually not high before, and the
and then
person
now
now
made
took
it low.
antihypertensive drugs.
So, what role do these auxiliary nurses have to play when it comes to people that have died as a result of BP and other related conditions? Because now
Mm,
a lot of these nurses just treat patients without. So, what role do you think they have to play? And yeah, well,
mm,
we'll get to the role of the government as well.
okay, yeah. First, the auxiliary nurses have no role to play. If you say auxiliary, you say auxiliary nurses.
Well,
No,
that's the most popular ones we know. I don't know if there are other ones
no,
but the
there's
ones
nothing. Auxiliary
always
nurses
giving
and these nurses are
injections.
not trained. Just trained nurses because the trained nurses already know what hypertension is and they can give you a health talk. Hmm? Yes, they can give you a very good health talk and counseling on hypertension compared to an auxiliary nurse. Auxiliary nurse does not have a formal training.
When it comes to
Yes, a formal
hypertension.
training. Yeah, so it's the role of nurses in management of hypertension. One is health education. Hmm?
Hmm.
Yes, they do massive health education for people, so people can understand the need to check their blood pressure.
Hmm.
Mm. Yes, that's the first one. That's the primary prevention. The secondary prevention is now if you are hypertensive, encouraging you to come to the hospital for a follow-up. These are secondary ways of prevention, getting it.
Getting it right, right? And you think that so how do you think the government can check this? Will we call it quackery? Quackery. How do you think that has contributed to um, you know, uh, not helping the healthcare system in terms of tackling issues like hypertension and the rest?
Okay, the nurses.
Yeah, like quackery and your practice, especially with the
Okay,
nurses, because
quackery.
like I said, a lot of nurses just go about giving injections. That's the reality of it right now. People
Yeah,
have malaria and typhoid, they give injection. You give injection, you give injection, and now you don't even know if the person is hypertensive or diabetic or. So what should be, what are your expectations of the government, and how do you think that this can be? How do you think this makes the situation worse, even?
okay. It's more of retraining, huh? Retraining of healthcare professionals, hmm, which is very, very important.
Okay.
Because most of the nurses I know that are well trained are more informed about hypertension, the drug use, and even the side effects that comes with the drugs.
But a
Yes.
nurse is meant to prescribe. Are they meant to diagnose and prescribe? I thought that's for you doctors.
Yeah, no, they can actually detect this person has blood pressure is high. Then they can now refer you to a doctor or tell you you need to see a doctor.
Hmm. Okay.
Yes.
But not to give prescriptions. Okay, now,
No.
so the Lagos State government launched a statewide free screening for hypertension and diabetes for residents that is still ongoing. And the initiative is actually under the Nigeria Governors Forum nationwide campaign to address hypertension. So, what are your thoughts on this? And how do you, what do you think governments can do to uh, help ease the situation of the silent killer, hypertension, and diabetes?
Mm. Okay.
Are there some,
Is it?
yeah, do you think,
Yeah, yeah,
yeah, go on, because doctors have complained about poor funding. Do you think the
yeah.
screening is something that is also going to uh,
Yeah, is a step in the
be
right
effective?
direction, but they still need to go further. It's not about just detecting detecting the people that are hypertensive or diabetic. You also have to still have access to medications. Hmm?
Okay, so
Access,
right now you think there
access
are no
to
access?
medications.
Yeah.
Yeah, because medications are very expensive now. Though most of the hypertensive drugs are cheaper, but in the long run, it may become very expensive. So access to medications is also very, very, very important.
Okay.
Mm.
And how
Health
about
insurance
insurance?
for people
Yeah.
to come to hospitals regularly.
Okay. All right. All right.
Yes.
So, just as we begin to wrap this up with you this morning, are there natural or alternative remedies that can help reduce blood pressure?
Mhm. Your line is cracking. Come back again.
So, I said, are there some natural remedies, like organic remedies, that can help to lower blood pressure?
Most of them are all being researched. Most of them are being researched.
So, all those things
Buying.
online about cucumber and the rest of them, they don't.
Hmm?
All those write-ups online about cucumber helping with blood pressure control, that's not it's not a given.
It's more of like when we say be on fruits and vegetables, lifestyle modifications. These will help reduce or high level of cholesterol. Hmm?
Mm.
And prevent the other complications that comes with hypertension.
Okay.
Yes.
All right then, so let's get your final words on hypertension this morning, and how important it is to also check your stress and everything level. And are there some organizations that help with the affordability of healthcare services for hypertension that you're aware of in the country, where one can easily access healthcare for hypertension?
No, no, no,
You
I
have to
don't.
pay.
I'm not aware about you can access drugs,
Hmm.
antihypertensive drugs. Many people access their antihypertensive drugs regularly from
Okay.
government-owned hospitals and some um, HMOs, mm,
HMOs. Okay. All right then.
private-owned hospitals too. So
Mm.
these are the ways government have been doing that.
All right. Let's get your final words on hypertension this morning, and why it's important that we check ourselves for hypertension.
Okay. What do you say?
I said your final words on the program this morning.
Okay. So I will encourage Nigerians to make it a routine to go for a checkup, especially your blood pressures. It doesn't cost much checking your blood pressure. It can save you a lot.
Mm.
Then for those who are hypertensive, they should ensure that they take their medications and have a follow up as much as possible.
Yeah.
And for the government, the government should formulate policies that will help Nigerians access medications quickly
Okay.
at an affordable rate
All right then.
to
Thank you
help
so much.
reduce high blood pressure.
All right. Thank you so much, Dr. Ukeka Chinedu, a resident doctor
Okay.
in family medicine. Thank you for your time with us on the program.
Okay. Thank you, Kimberly.
Yeah, so enjoy your day. Hypertension is serious. You've heard it from health experts, and they encourage all Nigerians, all of us, to always check our BP. Don't think you're too young to have your BP checked. And some health experts have said self medicating is even dangerous because you might be treating for malaria, not knowing that there is the silent killer, which is the BP right there. So look out for the symptoms, like Dr. Nkeka said. You might have headaches, you might have, the dizziness. You might just, I don't know, did he mention feeling tired? But anyway, just make sure you go for your medical checkup. And if you've been diagnosed with hypertension, it's important that you take your medication. I don't think it's something you can pray and, pray away. Yeah, the prayers will work, but you also have to comply with what do we call it, medical adherence. So you have to follow the prescription, and just yeah. So keep the positivity up that it will be properly managed as you do that. All right, take care of yourself. Check yourself regularly, and please stay away from stress. Enjoy